On our Health Talk series, our special guest today is Dr. Salil Midha. He is Chief of Cardiology at Melrose Wakefield Hospital in Melrose. He will also be one of our featured speakers at upcoming Health Expo, and there also he will talk about the same topic. So we are very glad to have Dr. Midha with us, and we are going to talk to him about how to prevent heart diseases. Dr. Midha, welcome to our studio.
Nice to meet you. I'm very pleased to be invited here.
Excellent. And first of all, thank you very much for supporting our Health Expo every year. You have been a constant part of every year we have done this Health Expo.
I am so pleased that all of you guys are doing such a good job, and I think you're sending a message to the public so that we can actually make a difference in our local population and our community.
Thank you very much. So let us start our conversation with one basic question, which some of us may not be aware. When it comes to heart diseases, how we Asian Indians or Indians differ from the Caucasian population?
Well, Upendra, we have a very serious problem among the Indian population and the Asian population. We are at much higher risk as compared to the Caucasian population. We have so many abnormalities in our genetic system which predispose us to get more heart attacks and get into more problems. Like, for example, our risk of diabetes is so high that at least half of the population in India either is pre-diabetic or have actual diabetes, but not are being treated properly. Our cholesterol levels is a serious problem. We have a very low HDL, which is a very good cholesterol, and we have moderately increased LDL. So the ratio between the LDL and HDL is somewhere between 4 to 5 to 1 or even higher than that. To have a proper ratio, which is 2 to 1 to prevent heart disease, we have a long way to go.
Do you have any number of Indian or Asian Indian versus the Caucasian?
Absolutely. Our risk of heart attack or problems with the heart is 2 to 3 times higher than the Caucasian population.
2 to 3 times is very, very high.
Very high. Actually, if you look at the European population and English population in USA and California, our risk of admission in the hospital, which they have, is about 100 per 100,000. Our risk is between 2 to 300 per 100,000 per year. That's very significant.
Now, also, is there any study about differences between men and women of Indian or Asian origin in terms of heart diseases?
Absolutely. The female population from Asian area or India is equally at risk. As a matter of fact, the number one cause of death amongst the Indian population now and in future is going to be heart disease and not cancer. Our Indian females have smaller arteries. In addition, they are very similar as far as diabetes is concerned. They have a high blood pressure. They have low HDLs, which is a good cholesterol. They are predisposed similarly to get heart attacks. In my practice, I take care of more Indian females at a younger age as compared to the Caucasian population.
And how do you define the younger age?
I'm saying younger age females below the age of 60. I have several females who have had angioplasties, and none of them even knew anything about it. A lot of females simply even have chest pain. We tend to ignore it. Oh no, this is not heart disease. In case of male, you get all the attention.
Sure. Now let us talk a little bit about how to prevent this, especially in the Indian American population. What are the 5 or 3 things we should do to cut down the risk?
Number one thing, we should go to the doctor, get our bloods tested. Make sure that we are not diabetic. If we have diabetes or we are pre-diabetics, we must go on a diet and exercise program. In addition to that, we can then talk about medications to treat diabetes. Number 2, I would check everybody's cholesterols to see if they have familial high cholesterols or they are acquired high cholesterols. So this way we can actually make a difference in treatment by giving cholesterol medications, which are extremely effective nowadays.
Now, talking about cholesterol, lately I've been reading in some news reports, and some people are saying that the treatment of cholesterol is a little bit much more, it's not needed actually. Is there any truth to that? Or?
No, I think everybody writes a little story, but I can present you and show you what we call evidence-based medicine, and there are about 20 studies which show that if you take proper treatment of cholesterol and lower the cholesterol, let's say an LDL, which is amongst Indian population is common to have an LDL between 110 to 160. If you lower that level down to 70, your risk of future heart attack goes down by about 2 to 3 times, or even as much as 50%.
What about, I also hear about aspirin, that take aspirin and it cuts down some risk as well.
I strongly advise everybody to take aspirin. Our body makes platelets which cause the blockages in the arteries. Everybody should take an aspirin. If you don't have a problem, you take 1 baby aspirin a day. But if you have had an event, then we give either aspirin, 1 or 2 aspirins a day. In addition, we give super aspirins, which is known as Plavix, along with that for those people who have had a heart attack.
Okay. Now, this is a very dumb question I'm going to ask you, is how do I know, or how anybody knows that they have any issue with their heart?
Well, I think the simplest thing would be is, even if you're young, when you're 30 or 40, heart disease starts very early. Go get your bloods done, look at the numbers, talk to your doctor. 45, 50, if you have any symptoms, I would do a simple test which we call a stress test. And a stress test will pick up between 80 to 90% of the times if you have any heart disease. If you have any symptoms, you must tell your doctor about that.
So what are those symptoms, like for a common person?
Common person usually is shortness of breath and chest pain. Commonest thing is you're walking, you cannot walk that far. You get a little bit discomfort in the middle of your chest. Sometimes it goes to the neck or jaw or into the back area. Never ignore that. Never say that is only because of your acid or something like that. Go to a doctor, get checked out, get an EKG, get a stress test.
Now, if you put all these different diseases and different parts of body and organs, I know the heart is very, very important, and it is sometimes difficult to really track it down. If the one thing I should be very careful with heart, what that one thing should be?
Well, the best thing should be is that you must exercise properly. In addition, go to a physician and get your blood test. Make sure you don't have diabetes and your cholesterol is under control.
Now, although we are talking about heart disease here, but all the time I'm hearing from you diabetes, diabetes, diabetes.
Mm-hmm.
Is there that much direct link with diabetes and heart attack?
Very much so. Diabetes will make you, there are 3 major risk factors for heart disease, and those are cigarette smoking, high blood pressure, and diabetes. If you have all those 3 risk factors, your risk of having a heart attack is about 3 to 5 times more as compared to the normal population. So, although a lot of us Indians do not smoke, but we have a high risk of diabetes, we have a high blood pressure, we have a high cholesterol. All of these things predispose us to absolutely 3 or 4 times more risk for having a heart attack.
What about some lifestyle, for example? How does a certain type of lifestyle has an impact on heart?
Big difference. Our body produces HDL, which is a good cholesterol. Exercise promotes production of HDL. We cannot change the male sex, which is a higher risk for heart attack. We cannot change our genetic background. But if we exercised and watched our diet, especially switched over to a more vegetarian diet and consumed more unsaturated fats and consumed more vegetarian food, that will definitely lower and help in prevention of heart disease.
So the main culprit in our situation is genetic, you think?
I think we have a very high genetic abnormality. About 50% of us have common things. We have borderline diabetes, we have a little bit high bad cholesterol, we have a low good cholesterol, we have what we call a central obesity, and we are rather inactive, all of us. And we have a lot of stress. For first generation Indians, we come here, you work 12, 15 hours a day. We don't exercise as much as we should.
Now, Dr. Midha, also I wanted to talk to you about you and your nonprofit organization have been doing a fantastic job in taking care of heart in Africa and also in India. So I want to talk about two things. Number one is tell us a little bit about your charity and what you do. And also I would like you to compare the heart disease in Africa compared to Indians in India and also Indians who are here in the US.
Very good question. I am proud to tell you that I started doing charity work in 1990. I was inspired by Dr. V.K. Saini, who is not with us anymore, and he started his first organization. So we have been going...
V.K. Saini, who is a physician here in Massachusetts.
Cardiothoracic.
Okay.
He unfortunately expired a few years ago.
Right, yeah.
And
his son is Sanjay.
Sanjay.
Yeah,
Sanjay
he's my neighbor actually.
Sanjay's fantastic family, Manorma and VK, they started. So I was first invited in 1990, and we went to India to do the pacemakers in a hospital which was Dr. Deepak Chopra's father's hospital, Mulchand Hospital. We started doing pacemakers there. And we kept on doing each year, and each year the program has grown. And in the last few years, the program had grown to a degree that I, along with many of the local area people, started Boston Cardiac Foundation. Now this foundation has been to several continents. We go to India every year. We have been to Africa for the past 3 years. In addition, we go to South America, to Paraguay. So each year we are installing between 40 to 70 pacemakers a year.
Excellent.
In my lifetime, I have actually implanted, with the help of all the charity and donations, over 600 pacemakers. And so that is like each pacemaker between $5,000 to $7,000. It's like donations of about $4 million.
And then 600 lives.
And 600 lives.
Yes.
And actually I was supposed to be in India today as we are talking to be doing the work. Unfortunately, I had to delay my program, and I'll go in the next several weeks or so to India because of other reasons. But once we go there in the Sitaram Bharatiya Hospital, we have a clinic in which we have between about 50 to 70 people who will show up.
I thought you were going to say that you had to postpone your trip because of this interview.
No, no.
No, I'm just kidding.
No, I understand that. But we usually see about 50 to 70 people in New Delhi. And in spite of being a city which is rich with hospitals and all that, there are so many people with problems in India with no money that we've been able to help. Most people, they have what we call a slow heartbeat or a complete heart block.
So the data for the heart disease in India is very similar to what we have here, right, in the Indian population?
Well, I would say our population here, the city population of India would compare very much to the people who have moved here.
Okay.
And because of the stress, because of smoke, because of not taking care of yourself and lack of exercise, our risk of heart disease is higher.
Then this leads to another interesting question is about what about the heart disease city versus rural area in India?
Well, in India there is no data, but I can tell you when I used to work in India, I would say risk of heart attack amongst city population about 3 times more than the village population. The villager actually is not eating processed foods. He is eating, the real vegetarian meals and all that, and then he's working hard. The city guy, all you do is you're on the go and you eat consuming saturated fats. We already have a genetic abnormality, and then the food, which is delicious, is always saturated, full of oil and ghee, and then we get into more problems.
What about how good or how bad is the ghee for heart?
It depends which kind of a ghee. If you're talking about
Like pure Shuddh Desi ghee.
that is a problem. That's all saturated.
I love the Desi ghee though.
As I would say, it is not what you eat, it's how much you eat.
Mm.
Do I eat ice cream? Yes. I don't eat a big one. I eat one scoop, one, tablespoonful of ice cream, and that's good enough. But there are so many other oils like what we call sunflower seed or canola oils and olive oils, which are low in saturated fats. So we should make an effort. We can use some ghee every so often, but at the same time, we should try to use more unsaturated fats.
Okay. So now, because of your work in Africa, I have to ask you, how is the heart situation or heart disease in Africa compared to everywhere else?
Well, in Africa, the coronary artery disease or blockages of the arteries of the heart is not that bad at all.
Mm-hmm.
They have what we call a rheumatic heart disease,
Mm-hmm.
which is infection which occurs as a younger child, and that leads on to heart blocks and valve problems. So the valve issues over there are much more. That's the way it used to be in India and America about 50, 60 years ago.
Mm-hmm.
Since the strep throats and sore throats have been treated effectively with penicillins and other medications, we don't get into the complications.
Mm-hmm.
When I started my initial fellowships in India in 30, 40 years ago, rheumatic heart disease was the number one cause of problems with all the valve issues. Today, that's not so. Today, suddenly the problem is blockages in the arteries, which is coronary artery disease. When you go to Africa, it looks like the way India used to be in 30s, 40s, and 50s. So they have a very serious problem in Africa. They have very poor care, they have very bad valves, and lots of people with heart block. Without advertising, when we go there, they have 10, 20 people lined up for us. And last time we only had 20 pacemakers, and we had to leave. We didn't have more devices to help the poor people. We didn't have enough time to do that.
And what about Latin America situation? There should be
That problem is even worse there.
in Latin America.
Oh, big problem. They, in addition to complete heart blocks there, they have like what we call cardiomyopathies and dilatation of the heart because of whatever infections they have there. And their problems are much worse. They are in Latin America and South America, people are rather even more uneducated. They are very poor. They have no help. We went to Paraguay, which is like 6 million people. 1 million people have like everything. 5 million have absolutely nothing.
Mhm.
They are poorer than the poorest man in India. Actually, people in India are more affluent than South America.
Mhm. Now the last question: when you go to India, see Kishore Kumar. We're talking about it earlier.
Right.
Kishore Kumar, Muhammad Rafi,
Mukesh. And many of these,
and Pandit Jawaharlal Nehru.
Pandit Jawaharlal Nehru, all of these were complications of high cholesterol and genetic abnormalities, getting blockages in the arteries and getting heart attack. If you look at the literature, a lot of people between the age of 50 and 60, a lot of sudden deaths happening are all because of
So
coronary
now,
disease.
looking back, we will think that all four of them, good people and very educated, very high positions and plenty of money. How they were not, what went wrong there? What might have?
I think one thing is that the coronary artery disease or blockages in the artery of the heart have suddenly, it's like an iPhone.
Mhm.
15 years ago, we had like a silly phone which didn't do anything. Now the iPhone does everything. In the last 15 years, there has been revolution of treatment.
Mhm.
We did not do angioplasties since till 1991, 92.
Mhm.
The first angioplasty was done in Germany in 1988.
Mhm.
And since then, nowadays we perform more angioplasties than the number of bypasses in America and even in India. I go to one of my friends, Dr. Satan, at Ascot's Hospital. We are sitting down, and in about 1 hour, he does 4 angioplasties. He's got 6 rooms running. He's sitting, he's seeing a patient. The room is ready. He would go in angioplasty and come back. And he, on an average day, does between 20 to 30 angioplasties a day. So this is a disease, it's rampant, it's epidemic.
Mhm.
Right now, the heart disease is an epidemic amongst Indian population.
And education, communication is one way to educate people at least to be aware of.
If we educate people, We lower people's cholesterol levels, we treat their diabetes, we put them in exercise program, we can reduce the risk of heart disease by 50 to 70%.
Excellent. Well, that's one of the reasons we are doing every year Health Expo. We get about 2,000, 2,500 people every time, and we have covered all these topics and everything. So, and I'm glad that you have been part of that thing we have been doing series, and we are looking forward to listening to you at the Health Expo.
I hope I'll make the difference. I certainly
sure.
would love to tell the community really the things by which they can make the difference in their life. I wish everybody listened and we could reduce the risk of angioplasty, bypasses, and death due to heart disease by a significant large numbers.
Dr. Midha, thank you very much for your time.
Thank you so much.